The next question actually looks at the embryo transfer technique. Did you know that there is a correct and wrong way of placing the embryo within the uterine cavity? Yes, there is. The embryo should ideally be inserted into the uterine cavity in the middle upper section of the uterine cavity, away from the cervix and away from the uterine walls. Incorrect positioning will lead to implantation failures. Full stop. If the embryo is placed too low, it can lead to an ectopic pregnancy because it will be closer to the cervix. And so the embryo does manage to implant, it will implant itself in the cervix. If it's placed too high or presses against the fundus, it can actually cause the uterus to contract, thereby expelling the embryo. Did you know that it is possible to have an ultrasound-guided transfer that greatly improves the accuracy of the placement of the transferred embryo? So for your next cycle, simply ask your fertility specialist. Say something like this: "Hey doc, for the next cycle, I would like to have an ultrasound-guided transfer." That's another thing that you might consider doing to increase the chance of your next IVF cycle being successful. Would you agree that the hands of a doctor who has done 500 embryo transfers is going to be a lot more skilled and possibly even more gentle than the hands of a doctor who's only done 20 embryo transfers? Obvious, isn't it? Yes, it is. But a lot of women do not know that it is possible for you to request to have your embryo transferred by the more skilled specialist. Often these fertility clinics have multiple doctors, so it's not just the doctor that you are dealing with that is working in that clinic. There may be a lot of different doctors. Granted, the fees of a doctor who's a lot more experienced, who has had a greater rate of IVF cycle successes, is going to be slightly more expensive than one who has less experience, but it's going to work out cheaper for you than having another failed IVF cycle. So another thing that you might consider doing for your next IVF cycle is requesting for your embryo transfer to be done by the hands of a fertility specialist who has a lot more experience with a greater IVF cycle success rate. A doctor who uses a gentle technique makes a big difference. Huge. Here's another tip. Did you know that some clinics also use muscle relaxants? Yes, they will use the muscle relaxants locally on your uterus, meaning that your uterus is less likely to contract during the embryo transfer. If the uterus does not contract during the embryo transfer, it is not going to expel the transferred embryo. If you don't ask, you will not get. So here's a concept that might be new for you. Did you know that mock transfers exists? This is basically a transfer trial, and we do this as a test before the real transfer actually happens. The purpose of these mock transfers is to make sure that we don't get any nasty surprises on the actual day when we're dealing with a precious embryo. So it will tell us if there's lots of trauma, lots of scarring along your cervix.